Hormone replacement therapy is vital for every single specialty of medical providers to understand and hopefully utilize. It's a foundational therapeutic for men and women to live long and healthy lives. Testosterone replacement therapy and even HRT, on average, 40 to 60% reduction in all-cause mortality, 22% reduction in cardiovascular disease. But at the end of the day, we also have to be able to critically think through these things. Hey friends, welcome back to the Nico Misleh Podcast. This is your host, Nico. Today, I'm going to talk a little bit about why I believe HRT should be something that every single medical provider should be extremely familiar with. And frankly, I think if you're choosing to ignore it or not become familiar with it, I really do think over the next 5, no more than 10 years, you're going to be left behind, like big time. I think it's happening. Honestly, if you asked me, I'd say over the next 2 years. Like this thing is taking off. It's not a fad. It's been around for since the 90s. Really, is when we really started seeing this huge kickoff of HRT, and it didn't really go so well because, of course, we were using non-identical hormones, which is a really bad idea. But I think the logic and the thought was there, which was, hey, I think just utilizing our hormones almost makes more sense than attempting to add, synthetic lab-made junk into our systems. So it was the really adoption of the idea of regenerative medicine and wellness medicine and preventative medicine and all that kinds of stuff. So I think bioidentical hormones, which is what I teach, and frankly, again, I hate that we have to use the term bioidentical. I think it doesn't make any sense. When I say HRT, I mean hormones. I don't mean Franken chemicals that were produced in a lab. So conjugated equine estrogen doesn't count. It's not really HRT. Neither is progestin or any of the derivatives of those. They're not actually hormones. They might look like hormones, but they certainly don't really act like hormones. And that's what the literature is very clear on. So I really don't like saying BHRT because it kind of gives way to there are these other types of hormones called bioidentical, which are actually just hormones, right? It'd be like calling motorcycles cars. Well, not really, not at all. Actually, they're very different things. Okay, let me get off my soapbox for a second. So what I'm ultimately driving at here is that I think every single medical provider should understand legitimate hormone replacement therapy top to bottom. I really do. I don't care if you're in psych. I don't care if you're, in functional med. I don't care if you're cardiovascular. I don't care if you're rheumatology. I really don't care what specialty you're in. And the reason why I don't care is because that HRT is literally impacting every single biological system of the human being and the human organism. Now, do you have to be the one providing that? I mean, look, if you're a cardiovascular surgeon, do you really need to be the one prescribing TRT? I don't know, probably not, but probably your colleagues should be on the outpatient side of things. And you should at least have the understanding that TRT, for example, is not going to cause someone to just die of a clot in the middle of surgery, right? These are the reasons why I want every provider to understand and feel comfortable, and not just comfortable, confident in hormone replacement therapy, because it does so much freaking good for people. It's not even funny. And yet for some reason, HRT is still seen as this fringe or alternative therapy when we literally have some of the largest randomized control trials and observational trials ever done proving that things like TRT and HRT for men and women is probably the safest, most effective, most life-changing thing you could do for any single one of your patients from the ages of, literally 18 to 80 kind of thing, right? I mean, old and young, doesn't matter. They are absolutely necessary and incredible. And I talked about this at my conference that was called the Nico Live event. I don't know where I swear, I think, I get these messages, I feel like, and I feel like when I was talking about hormone replacement therapy, I had this idea that, hormones are not alternative. HRT is not alternative. Alternative therapies, what does that even mean? I think alternative therapies are things that are not well studied, not well researched. Maybe we have some, interesting signal coming from over here. And, it might not have all this amazing evidence-based literature around it, but at the very least, it might be something that we could utilize for a certain condition. Okay, so what could that be? Well, that could be something like a herbal supplement, like rhodiola, right? We have some studies on rhodiola, actually some pretty good studies. Seems like a good signal overall. Is it the most impactful thing in the universe? Is it going to reverse insulin resistance and diabetes and cardiovascular disease and improve osteoporosis? No, it's not going to do any of those things, right? But it does have some benefit. And so I think something like that, we could still call it probably an alternative therapy. And I think that would be very reasonable. Here's where I'm going to go off the rails a little bit in a good way. I think, for example, giving someone birth control, especially an oral contraceptive, for cyclical migraines, I think that is more of like an alternative therapy. Oral birth control, if we're looking at this in a long-term trajectory, is not the safest or most effective thing we could give to a young female, say that at the age of 13, experiencing for the first time in her life cyclical migraines with her periods. Why would we not utilize something like bioidentical progesterone, which is, in fact, largely the root cause of her migraines? So rather than chemically castrating this young female and, completely obliterating her own production of estradiol and progesterone and all these life-saving things and hormones that she's supposed to be producing to develop and grow into an amazing human being, well, let's just chemically castrate her. Will it get rid of the headaches? Probably, yeah. Is that the most appropriate therapy? No, it's definitely not. If that's my daughter, I want her to live a long and healthy and beautiful life. And if she has progesterone insufficiency in any way, shape, or form, I would just give her bioidentical progesterone that the body produces itself. Will that improve the symptoms? Yeah, it will. Let's take this a step further. Let me be maybe a little bit more, I don't want to say controversial, polarizing. That's not really the goal. Let me just go against the grain a little bit. I think largely most patients being given things like SSRIs, for example, I think that's inappropriate. I think of that as an alternative. Actually, this is probably even better example of an alternative therapy, because what the literature has shown, and I talked about this at my conference, that the literature has shown, Dr. Joanna Moncrief, one of the leading research psychiatrists in the world out of Oxford, proved this in 2023, I think it was, in the summer of 23 in June. I think I read this study and was just floored by it. Meta-analysis of all the different randomized control trials out there and observational studies looking at SSRIs. Do they help? Is that the actual root cause? Is serotonin, more specifically, what is causing low serotonin depression? What did the randomized control trials say in observational studies? No. It is not clear at all that it has anything to do with serotonin whatsoever. In fact, it appears that elevated levels of serotonin can cause depression, which makes sense. If you've taken my HRT University course, you would know why that is, because serotonin is not a happy hormone. It's a stress hormone, stress neurotransmitter. But more importantly, we're looking at depression and anxiety in the wrong light. Those are symptoms. It's not a disease state. It's not like type 1 diabetes where your pancreas is broken, your beta cells don't work. We got to give you insulin. It's pretty obvious. We can cut you open and look at that. We could check your blood sugars. We could do all these different things to determine that. We can't do that with depression or anxiety. I can't cut your brain open and figure that out. It's multifactorial. There's a lot of different things. And I think actually hormones are probably one of the more foundational pieces of that puzzle. I mean, if you go into a doctor's office and you say, I don't know, doc, I'm tired. I feel kind of sad and lethargic and, I'm gaining all this weight and I'm not sleeping that well, blah, 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 blah. Well, they're going to have you fill out a PHQ-9, this little survey, 9 questions. And it's going to basically help them determine whether or not you're depressed, which probably you're going to score high because you said all the things that you're feeling. And that all equals major depressive disorder. And what do? They give you an SSRI, selective serotonin reuptake inhibitor. And it's going to whisk away all your problems. And it doesn't. It really doesn't. Can it help? Yes. Just like oral birth control can really get rid of migraines really well. Absolutely. Does it actually help? Does it heal? Is a better question. Does it heal the person? I don't think so. I think in the long term, again, short term potentially, in the long term, which by the way, those medications were never meant to be taken for longer than 3 months at best. In the long term, what we see is that these medications destroy your ability to produce sex hormones, something called steroidogenesis, right? It destroys your metabolism. It slows it down. It can destroy your libido and sexual function. It can cause you to gain weight. It increases your likelihood of metabolic disorder at large, disease. That is not a medication that makes any sense if we're saying that the literature shows that low serotonin has nothing to do with it. I'm giving you a medication that we don't even know really. I mean, in theory, we're just assuming this is how it works, really. It's theoretical. It's called the monoamine hypothesis, really. It's hypothetical, really. Like it's all based on these ideas that we had and which has been disproven. Has been almost disproven, relatively speaking, since like the early to mid 90s. And yet we continue to use an inappropriate and what I would consider alternative therapy that has very weak evidence around it and frankly, very little health benefits over time. Now, if that same patient comes into the primary care office and says, I'm feeling kind of low mood and maybe depressed and, I'm gaining weight, blah, blah, blah. What if I check a thyroid panel? What if I check their testosterone? I don't care if they're male or female. What if I check either one of those two things? What about their progesterone, their estradiol? What about their things like vitamin D even, right? There's so many things we could be checking. Zinc, magnesium, there's 1,000 things we could be checking, but let me just speak from an HRT perspective as one of the most foundational things and beneficial and wonderful and safe things we could do for a human being. Why wouldn't I look at hormones? Which, by the way, if you look at, if you just type into Google, thyroid and depression, testosterone and depression, estradiol and depression, you'll find hundreds, thousands of articles showing there is quite strong association. In fact, with thyroid, there's not even, I mean, it's practically a causative agent of depression, which is a symptom. Again, it's not a disease state. It's a culmination of things, right? Oxidative stress, environmental factors, hormone dysregulation, right? All those things compile and lead to a state of depression, right? Which is just a series of symptoms. It's a syndrome, right? It's more like PCOS. It's a culmination of things that lead to this problem. So is depression real? It's super real. Guys, it's the most real thing ever. I mean, if you've ever suffered from depression personally or known someone who experiences that, it's really miserable. It's not pleasant. It's awful. And so I think what that person deserves is a not an alternative therapy, which would be like an SSRI, which doesn't really hold much water at this point. What they really deserve is a foundational therapy, a therapy that's evidence-based and not only can provide amazing benefits in the short term, but also extraordinary health benefits in the long term. Right? Your health actually gets better over time with HRT. We don't see that with a lot of medications, right? Most medications, it's a huge give and take. I give you this medicine, the likelihood of you developing X, Y, or Z, side effect or adverse event or long-term poor health outcomes is high, right? I mean, we see that really clearly with like immunosuppressants, for example. They're terrible for human beings. Will they get rid of some of the symptoms that they're experiencing? Yeah. Over time, is it great? No, it sucks. It's awful for those people, right? Pardon, my phone's buzzing. I mean, it's no good at all. So I think that when it comes to hormone replacement therapy, I think it's very, very clear that hormone replacement therapy is vital for every single specialty of medical providers to understand and hopefully utilize. And if they can't do it themselves, which is fair, again, if you're a surgeon or if you're, just in a very, that super, super subspecialty of medicine where you really don't have time to do it, someone in your universe should be doing it. whether it's outpatient, I don't care what it is. But you, even as a surgeon, I'm not just picking on surgeons here, by the way, but even as a surgeon, you should be absolutely familiar with the health benefits and safety of these things. So again, I'm picking on cardiology for a second here. I love my cardiologist, but I always get patients tell me, well, I'm going into surgery and I have to stop my TRT. Why? It doesn't make any sense. There's never been any historical evidence that testosterone replacement therapy causes an increase in strokes and clots. In fact, the Traverse trial pretty much disproved that. It was removed from the FDA black box warning. I mean, guys still produce testosterone when they're not on TRT. So is that bad? Is that dangerous? Do you castrate every guy before they go into surgery, chemically or physically? Like, no, of course not. This is just crazy. It's nonsense. And the literature shows that and the evidence shows that. This is a foundational therapy. It's not optional. It's not fringe. Okay. It's seriously not optional. It shouldn't be viewed that way at all. It should be no more optional than it is me taking a breath of air and drinking clean water. Like, it's a foundational therapeutic for men and women to live long and healthy lives. I'm going to read you this list because I think this is extraordinary. Okay. So you tell me how many specialists and even general practice providers HRT will impact. So testosterone replacement therapy and even HRT, on average, 40 to 60% reduction in all-cause mortality. That's what the studies show, 40 to 60%. You will die less of practically everything if you start taking these medications. It has a 22% reduction in cardiovascular disease prevention, right? Incredible. Can you name that? I mean, primary care at large, all-cause mortality down. Yeah. How about cardiovascular disease? Should cardio be involved in this? 100%. 100%. Does HRT and TRT not improve osteoporosis? It improves it massively. What about the musculoskeletal system at large? Does it help keep muscle mass on board? 100%. Should your PM&R docs, your rehab docs, and orthopedic surgeons and orthopedics in general, should they not be extraordinarily familiar with hormone replacement therapy? You bet your ass, right? Why are we still providing Fosamax and telling women to just lift heavy weights? This is crazy. I mean, not the heavy lifting part. That's great. But try heavy lifting when you're 60, 70, 80 years old. Your bones are brittle and you have no muscle. Try it. I mean, it's not fun. By the way, your energy is terrible. You probably have a little bit of insulin resistance. Would hormone replacement therapy not have prevented that if you had started it much earlier? And certainly even at that age, if you add it in, would it not make it a little bit better? 100%. Who knew? How about genitourinary stuff? Vaginal dryness, vaginal discomfort, vaginal irritation, recurrent UTIs. You know how many women die of UTIs? Recurrent UTIs? These poor women, especially in nursing homes, men too, stuck in nursing homes with catheters 24/7, taking antibiotics all day long because they can't get rid of these infections and they die from them eventually. They go septic. A lot. You know how uncomfortable it is anyways? Like, if you're not even in a nursing home, getting those recurrent UTIs and having to take antibiotics all day long, it sucks. Do you know what totally prevents that? Estradiol, testosterone. What about sexual health? The health of the human penis and clitoris, right? Things we're not supposed to talk about on air. Does that make a difference? Do you think that strengthens marriages and relationships, especially in the later years? Or even in the early years, for God's sake? Do you not think that's important? Isn't sexual health probably one of the most amazing and incredible things that we have as human beings? What about fertility? Doesn't that all kind of go together? Shouldn't a urologist understand these things? Or any genitourinary specialist out there? What about OB-GYNs? Absolutely. Again, these are foundational things, guys. This is really straight and true, tried and narrow, right? Like we know these things work. I'm talking about things from the literature. What about insulin resistance? I mean, like, How many people, I constantly am hearing about insulin resistance. The insulin resistance is the worst thing ever, but it's killing everybody. It is. It's terrible. Insulin resistance is kind of one of the, I think there are root causes before insulin resistance. I think insulin resistance is kind of the, relatively speaking, kind of the secondary root cause to a lot of things. I think most of that before that is hormone deficiency and dysregulation from environmental chemicals and toxins and all that stuff, which you can learn in HRT University. I want you guys to understand this stuff. But my God, if we improved insulin resistance by 20, 30, 40% in the United States, do you know how much money we would save in taxes? You know how much we would be able to support and maintain life that is worth living if we just helped get rid of insulin resistance by a little bit, by a fraction? It'd be massive. How about Alzheimer's disease? You ever heard Alzheimer's disease is like, I think they've called it like diabetes type 3 or type 4, whatever they call it now. Is it impacted by insulin resistance? Sure. But part of it is absolutely. What about just the loss of hormones? If you lose estradiol, does it impact your beta amyloid plaque and all that kind of stuff? Yep. Big time. So should neurologists be familiar with this stuff? Yeah. Endocrinologists, of course, they should be the most familiar. I'm not disparaging endocrinologists. They do an amazing job, but these guys and gals aren't taught hormone replacement therapy in school. Not like they should be at all. They don't understand it. And it's not their fault. I didn't understand it either. I'm just letting you know. I'm not saying I'm the smartest guy in the universe either. I'm really not. But I have a keen interest and curiosity, and I look at the literature, and I like to make sure that what I'm doing makes sense logically. The amount of urologists, let alone endocrinologists, that I see prescribing things like testosterone replacement therapy, one injection of 200 milligrams every 3 or 4 weeks, it's insane. Do you know what that does to a human being? I just wrote an email about this today, but I liked it, so I'm going to add it in today. If you give a guy 200 milligrams of testosterone cypionate, an injection of testosterone, in one big bolus dose, once every 3 to 4 weeks, the half-life of testosterone cypionate is about 2 weeks. Okay? So your serum testosterone level, in general, your testosterone will drop 50% in 2 weeks. How much does it drop in 4 weeks? 100%. You are putting this guy in a roller coaster without a seatbelt and just have fun, man. Trust me, you'll have an up. That'll be fun, but the down sucks. And then you got to climb all the way back up again just to go down. Well, what if we did those injections 2 or 3 times a week, right? We split the dose up. So now you're only dropping maybe by 25% at most. You're probably not even going to feel that or notice that. Wouldn't that be better if we stabilize those levels? And why would it be so much better? These are the kinds of things I want you guys to know. I could talk about that for 2 hours. and I kind of do in the master course, in the HRT University master course, because it matters. You really need to understand these things. By the way, evidence-based literature doesn't talk about that stuff. And this is why I'm not beholden just to evidence-based medicine. It's really important. I take these randomized control trials extremely seriously. It's one of the things we can really hang our hats on. But at the end of the day, we also have to be able to critically think through these things. And I have to be able to trust that what I'm doing makes sense from a physiological standpoint, and do my patients feel better doing it that way than the other way? And do I notice better outcomes? Yeah, I do. Absolutely. I'm not the only one, by the way. I didn't come up with this stuff necessarily. These are things that I've learned over time. Some of it I came up with, but you see what I'm saying? Should psychiatry at large totally flip the script on what they do and start pursuing things like HRT probably as the primary focus? I think so. Yeah, I really do. I really feel strongly about that. Even for those, strong axis 1 types of things, schizophrenia, bipolar disorder, whatever's listed there. I think so. If hormone replacement therapy is the foundation one of the foundational metrics and data points and therapeutics of the human organism, right? We produce hormones all day long, every single day of our lives. Should that not be something we're considering? I mean, for God's sakes, we're looking at sunlight and drinking clean water and eating good foods and exercising and all that. That's amazing. We have to do those things. That's really, really foundational. I think hormones are right there with it. I think they're on par with each other. I don't necessarily think one is better than the other. I think that much of the lifestyle things that we're doing is actually just really, truly impacting hormones and our overall physiology. The bummer part is that our world is a little bit toxic. Not a little bit, a lot of it. We don't have the nutrients in foods like we used to. It's sprayed down with pesticides and herbicides. We've got plastics all over the place. Literally in utero, it's damaging male Leydig cells, female ovaries. Like it's already beginning the process so that when people are born today, their hormones are not as healthy. Their ability to even produce hormones is not nearly as healthy as it was 10 years ago, 20 years ago, 30 years ago, 40 years ago, right? We started seeing that in the 70s and 80s. That's what the literature's shown. I mean, we've lost like 60% of total testosterone levels, not just in men and women too. Like, what the hell are we doing? That's crazy. That's like saying, we had a 70% decrease in the oxygen in the air that we breathe. That would not be good. We should really figure that out and fix it. Right? And by the way, I'm hopeful. I'm always a glass half full guy. I think there's going to be some amazing things coming out. But right here, right now in this day and age, what do we have at our disposal that is safe, effective, that has evidence-based literature to back it up, randomized control trials, things that we can really, it's like salt of the earth stuff, man, that we can hold on to and trust. Well, that's hormone replacement therapy, by and large. By and large. I've said this before and I'll say it again too. Hormone replacement therapy, TRT, whatever. This is not an old person's thing anymore. Okay. I feel like there's still that bridge to cross too, which is that TRT and HRT is like, well, once you're of the age of, 45 or 50, we could start thinking about it. Maybe. That's crazy. That's totally crazy. We don't do the same thing to diabetics, right? If we have a type 1 diabetic and they're not producing any insulin, I don't say, well, you should really try to diet and exercise and lifestyle this until you're 30, and then maybe we can talk about it, or 40. If they're 15 or 12, I would give them insulin. Why? Because it's pretty clear that's what their body requires, and they'll live a much better quality of life, literally. Right? Even type 2 diabetic at the most severe state. Obviously, we could reverse that, but you see what I'm saying here, right? Why would I withhold testosterone replacement therapy from a 16-year-old male or a 21-year-old male? Why would I do that from a female who's suffering from those cyclical migraines, right? I wouldn't ever. Why would I? It's one of the most safe things I could give her. I mean, shit, it's bioidentical progesterone is better than freaking ibuprofen. Tylenol certainly has a safety profile. It blows it out of the water. Blows it out of the water. You know why? Because the body produces it. And this isn't just like, it's natural, that's why. But that's a huge part of it, guys. Come on. I mean, we can't ignore that. Our body has spent a millennia optimizing around these hormones. And we barely understand it. But what appears to be very true in the clinical literature is that these things certainly don't seem to hurt. What we see is that they help a lot. And they're super safe and super, super, super effective. So again, my hope is that whatever part of the healthcare and medical industry and specialty you are coming from, I don't care what kind of medical provider you are, I hope you understand how important this is. I hope you start seeing it as the big picture. Patients are asking for this stuff. They're learning more and more about it every day. We got freaking Oprah talking about it. We got the current White House is talking about it. Like we've got people talking about it. Big people on the big screens and the big media outlets. It's being heard. And patients are looking for this. They want this, as they should. And rather than feeling anxious and not confident and feeling overwhelmed, because it can feel that way with HRT. It really can at first. You're learning something that none of us were ever taught this stuff. It's kind of like going back to school. That's why I created HRT University, guys. I created it because I understand that you have to understand this stuff at a depth that helps you feel confident and assured. Then you have to continue learning this stuff. And you'll stand out that way. And patients will flock to you, literally. They need someone like you that understands the value of HRT beyond just, the superficial stuff. It really gets the physiology and the pathophysiology. And who also cares? You want to be a pioneer in this field, guys. It's so fun. It's so interesting. It's so exciting. A lot of providers, they say, Nico, after I take HRT University, the master course, after I took it, I felt like it renewed my sense of hope and joy. It brought back the magic of real healthcare and real medicine. Because that's what we got in here for, guys. I know that's what I did. I did not get in here just to follow these terrible algorithms put out by whatever 3-letter agencies or, organizations that suck. They don't make people better. When I see my patients, they've been doing all that stuff. They've been doing that stuff since the dawn of time. When they come to me, again, we're flipping the script. Baby, we're changing the game. We're actually helping these patients get better. And when you see that happen, it's extraordinary. It's addicting. And when those patients feel it, they talk. And people start asking, yo, Jamie, what happened? You look like a new person. I feel like a new person. You know why? And I love that. I love that because, again, I talked about this once before, but I hope that I live in a world where my colleagues of all specialties and licensees, I hope that they're doing things that are meaningful and purposeful for themselves and their patients. Because the more people that do that, the safer and more beautiful and the more uplifting the whole world becomes. It's a little butterfly effect. And I know a lot of times it feels like you got a lot of weight on your shoulders, you're running a business, you're taking care of your family, whatever it is, you're working for a big healthcare system. I get it. But I want you to just take a moment and recognize how powerful you are, how much responsibility you hold. We took an oath in some ways, stepping into this field. It's a big responsibility. But believe me, guys, it doesn't have to feel like a burden. It can actually feel like a gift from God. You know what I mean? That's what it feels like to me. I know every single day I'm doing something that is valuable and effective and great for my patients. And sure, you're going to hit some hiccups and road bumps. It's medicine. You're dealing with human beings. It's some of the most complicated work out there. But I want you to understand that you don't have to be afraid of it anymore. You don't have to feel overwhelmed by it either. Literally, you don't. HRT University is set up for you to be successful in every avenue possible on that front. If you wanted to treat a patient 2 days later, you totally could. You really could. I'm dead serious. Because you're going to have that information forever, and you're always going to be able to go back and look at it. We've got Pearl, our amazing our amazing AI mentor. She's incredible. We created her so that literally you can have what feels like a pocket colleague ready and waiting to answer any single one of your questions and refer back to the course and show you where it is and help you create some really good plans for your patients. We have a community, an amazing community of providers, just the best. High quality people who really love what they do and want to just knock it out of the park. And they want you to do your best because we're all in this movement together. We see the vision. Yeah, we understand the mission. And so this isn't a cutthroat competition here, guys. There's so many, you know how many millions of Americans there are who need HRT, let alone people just in the world? Trust me, you're not going to run out of patients, guys. You're not. All right. I hope this has got you thinking a little bit. If you've been sitting on the fence, if you've been wondering why HRT, does this matter? Is this something I should really be doing? Maybe you've already taken some courses and you're just like, dude, it was terrible. Like, these courses sucked, or I just didn't feel any more. In fact, I left feeling more confused. That is, you are exactly the reason why I spent so many months and years, frankly, coming up with HRT University. You were exactly the reason. And I want you to know I was in that place too at one point. I really was. And every single one of us were. Like, none of us learned this stuff, okay? But I want you to, I know you don't know me maybe that well, but I want you to trust me. I want you to understand that I love you, and I want you to kick ass at this, because our freaking world and our communities need this. And I know you can be that hero. I know you can be. And you can create that butterfly effect, that ripple effect that's going to echo through time. And you'll go down the history books, believe me. You really will. You might not be, Julius Caesar. You're going to go down the history books as one of those brave providers who understood that HRT means more than just that superficial stuff we hear on TV or TikTok. All right, guys, think about it a little bit. Don't forget, if you're not on my daily email, please join. Nico's daily email is an amazing source, amazing way to learn. Tons of free education on HRT. I give away tons of stuff there. You know why? Because everybody needs to know this. There's a link below. Opt in. Please join us. There's like 1,000 and something odd people on there now. It's incredible. Medical providers. You can join our Facebook group at Nico's HRT University, another great place, totally free to hang out and just kind of network and get to know people, dip your toes in a little bit. And then, of course, check out HRTuniversity.com. If you're like, Nico, I'm ready. I want to take this master course. Check it out. I think you'll really love it. I've not had a bad thing to hear about it, which I love. And I'm really grateful for that. I want it to be great for you. So thank you so much, guys. And I'll see you at the next episode.